Welcome back to Dr. Bob's Medical Insights, your trusted source for real medical stories and women's health awareness. Today we share the story of a 35-year-old woman who discovered a hard lump in her breast. We'll also explain the life-saving role of mammograms and self-breast examination. This is something every woman should know. Meet Anna, name changed. Anna is 35, a busy professional and mother of two. One morning, while showering, she noticed a small, hard lump in her left breast. At first, she thought it might be hormonal or just a cyst. But as days passed, the lump remained. Worried, she visited her doctor. The physician asked,
"How long has the lump been present? Any pain, nipple discharge, or skin changes? Any family history of breast cancer?"
On examination, the lump felt firm and different from the surrounding tissue. The doctor recommended further tests, starting with a mammogram and an ultrasound. Not all breast lumps are cancer. Common causes include fibroadenoma, a benign growth common in younger women, cysts, fluid-filled sacs, infections or abscesses, and less commonly, breast cancer. But here's the key. You can't tell for sure without proper evaluation. That's why medical imaging and tests are crucial. A mammogram is a special breast X-ray that can detect lumps, microcalcifications, and early signs of cancer, even before they can be felt. For women under 40, sometimes ultrasound is added because younger women's breast tissue is denser. Together, these tools provide a clearer picture. In Anna's case, the mammogram showed a suspicious area and a biopsy was performed. Thankfully, it turned out to be a benign fibroadenoma, not cancer. But this early evaluation gave her peace of mind and prevented delays if it had been cancerous. Anna's story highlights the power of self-awareness. By regularly checking her breasts, she noticed the change early. Self-breast examination tips. Do it once a month, ideally a week after your period. Use the pads of your fingers, move in circular motions covering the entire breast and armpit. Look for lumps, skin dimpling, nipple changes, or unusual discharge. Report anything abnormal to your doctor right away. Remember, BSE is not a substitute for mammograms, but it's a powerful tool for early detection. Anna's case is a reminder. Don't ignore a hard lump in your breast. Early detection through mammograms and self-exams saves lives. If you found this story helpful, please like, share, and subscribe for more health awareness videos. Together, let's spread knowledge and save lives.